All right, let's dive right in. We're about to give you a preview of how the CSMRN framework trains you to think clinically about one of the most high-stakes areas in all of nursing, cardiovascular care. So think of this as your sneak peek. You know, everything in cardiac care really boils down to this one thing, recognizing patterns. When a patient shows up, you are literally racing against the clock. And being able to spot the right pattern isn't just about getting the right answer on your exam, it's about getting the right intervention to the patient right now. And this is exactly where things get so tricky, right? Is that chest pain just a muscle strain, or is it a full-blown MI? Is that shortness of breath from anxiety, or is it acute heart failure kicking in? If you miss those subtle clues or make the wrong call, well, the consequences are incredibly serious. Let's be real for a second. Studying cardiovascular disorders can seriously feel like you're trying to drink from a fire hose. You've got dozens of conditions, really complex pathophysiology, and just a mountain of symptoms to try and memorize.
Do any of these struggles sound familiar? Trying to tell all the different kinds of chest pain apart? Or figuring out if the issue is with the heart's wiring or its actual structure? Catching those sneaky early warning signs? And then trying to do all of that when the pressure is really on, either in an exam or, a real clinical setting.
So here's the bottom line. Simply memorizing a bunch of facts about arrhythmias or heart failure, it's just not going to cut it. You have to build your clinical reasoning. You need to be able to look at what's in front of you and ask, okay, what is the heart actually doing in this moment? We call this feeling cardiovascular chaos. You're looking at this huge jumble of conditions that all seem to show up with chest pain and shortness of breath. So how in the world do you bring some order to all that chaos? Well, the answer is you use a framework. And that is exactly what the CSMRN method is all about. Instead of just trying to memorize a random list of diseases, we organize them into logical categories based on what's fundamentally wrong with the heart. This whole approach shifts your focus from just memorizing to truly understanding. Now, take a look at this. This simple table. This is the magic key. Pretty much every major cardiac condition you're ever going to face can be sorted into one of these 4 buckets. Is it an ischemic problem, meaning a lack of blood flow and oxygen? Is it structural, an issue with the physical pump itself? Is it electrical, a problem with the heart's rhythm? Or is it inflammatory? This framework becomes your mental map for every single cardiac scenario you encounter.
Okay, so let's see how this actually works in practice. We're going to start by breaking down 3 of the core problem categories that you'll see most often.
Think of it this way. An ischemic problem, like acute coronary syndrome, means the heart's plumbing is blocked. A structural problem, like an aneurysm or heart failure, means the physical pump itself is broken or damaged. And an electrical problem, like an arrhythmia, means the heart's internal wiring is going haywire. See? 3 totally different root causes. Okay, check this out. A classic scenario. A patient is clutching their chest, the pain is radiating down their arm, and nothing they do makes it feel any better. You can almost see the pattern starting to form, right? So, thinking back to our framework, which one of those buckets does this immediately make you think of? That specific pain pattern, the fact that it's not relieved by rest, that is the absolute hallmark sign of ischemia, a critical lack of blood flow to the heart muscle. Let's switch gears and move to our next big category. Because sometimes the problem isn't a blockage or a pump failure, it's actually an attack on the heart tissue itself. And this is where knowing the location is absolutely everything. Is the muscle inflamed? That's myocarditis. Is it the sac around the heart? Pericarditis. Or is it the inner lining and the valves, usually from an infection? That's endocarditis. The location tells you everything. Okay, here's another pattern for you. You've got signs of an infection, the fever, plus a brand new heart murmur. And that clue about a recent dental procedure, that is huge. Bacteria gets into the bloodstream and settles on the heart valves. This pattern practically screams endocarditis.
All right, now let's talk about what happens when the heart, as a pump, just starts to give out. This is all about its ability to effectively move blood around the body, what we call perfusion.
The 2 big players you have to know here are heart failure, where the pump itself is just too weak or stiff, and hypertension, which puts a ton of strain on that pump over time. They're totally interconnected.
So you see this patient. Their legs are swollen, they can barely catch their breath, and they are just exhausted. What is this pattern telling you? Well, it's telling you that blood isn't moving the way it should be. It's backing up. This is the classic picture of a pump problem, heart failure.
Now, while every single cardiac issue is serious, there are some patterns that should make every alarm bell in your head start ringing immediately. These are the ones where every single second counts. Think about this one. This isn't the crushing pressure of a heart attack. No, this is different. This is a sudden, severe, tearing or ripping pain that goes straight to their back. This specific, terrifying pattern is the hallmark of a potential aortic dissection, which is a structural emergency of the absolute highest order.
You see how this all comes together? It all comes down to this simple idea, moving from recognizing the pattern to figuring out the priority. This right here, this is the clinical success path that CSMRN teaches. It's a simple, repeatable process. Step 1, you see the clues and you recognize the pattern, just like we've been practicing. Step 2, that pattern helps you identify the severity. Is this urgent or is this a drop everything and run emergency? And step 3, knowing the severity tells you exactly what to prioritize. It's a straight line from pattern to intervention. See, this isn't about just memorizing facts from a textbook. It's about building a mental model for making smart clinical decisions. We train you to rapidly connect symptoms to the underlying cardiac issue so you can make the right call and make it fast.
And at the end of the day, this is why it all matters so much. The skills that are going to help you crush your exams are the exact same skills that are going to help you save a life one day. This was just a little preview of our approach. The full cardiovascular framework is waiting for you inside.